Do you know me? Do you recognize me?
Chances are, you've probably seen me around.
On the outside, I look like every other kid you may know.
But on the inside, I have type 1 diabetes.
Diabetes is not contagious. You can't catch it from me.
In fact, people don't know why some kids get type 1 diabetes and some don't.
There is no cure, but we know the symptoms, and we can control it.
So I bet you're curious. What is type 1 diabetes?
An organ in your body, called the pancreas, produces an important hormone called insulin. Insulin is what turns the food you eat into energy, and we all know how important energy is to kids. But my body doesn't make any insulin, so when I eat, the sugar in my blood never turns into energy. The blood sugar levels just get higher and higher with no place to go.
If left untreated, I could be at risk for organ damage.
To my heart, liver, kidneys, and even my eyes.
But don't worry. Luckily, there are ways I can add insulin to my body and keep my sugar levels normal, just like yours.
Throughout the day, I check my blood sugar levels using a glucose meter. You may see me doing this in the classroom before I eat or begin any kind of strenuous exercise. Checking or testing involves taking a drop of blood, usually from my fingertips, and placing it on a special test strip in a glucose meter.
Once I test my blood sugars, I know how much insulin I need to give.
Kids like me usually need insulin shots several times a day.
The exact number varies from person to person, but we take them at regular intervals every single day.
Some kids use shots or insulin pens. It can hurt, but you get used to it.
I use an insulin pump.
The pump gives me a small, steady dose of insulin through a plastic tube, which is attached to a small needle inserted into my skin. When I eat, I just push this button, and it gives me an extra amount of insulin. The insulin I inject goes into my system and helps my body change food into energy.
Figuring out how much insulin I need depends on math and a lot of other different factors.
They include how much I exercise, what I eat, my blood sugar level, my stress level, even how I'm growing.
I play football, and when I play, I have to check my blood sugars before, halftime, and after the game.
I like to have a sleepover with my girlfriends, but I have to be careful when I'm playing and having fun that I don't crash. Crash is when my blood sugar drops.
It's not my fault if my blood sugars get out of control, because I can't do anything about it. So please try to understand.
Usually there are two problems with diabetes. One, of course, is if your blood sugar gets too high.
This can happen if any of the following things occur: not having taken enough insulin, eating more than usual, eating earlier than usual, eating food with higher carbohydrate content without injecting extra insulin, a clog in the insulin pump tubing, less exercise than normal, stress, or illness.
If my blood sugar is too high, I might have a reaction, and I may need your help.
Now look, don't be afraid.
The most important thing you can do is stay calm and help me find a solution.
Here are some of the symptoms that tell you my blood sugar levels are too high: thirst, frequent urination, blurry vision, stomach pain, increased hunger, nausea, drowsiness, lethargy, or exhaustion, confusion, sweating, fruity, sweet, or wine-like odor on my breath, vomiting, inability to concentrate, and/or weight loss. High blood sugars in the short term won't put me in danger right away, so if you see these warning signs, don't panic.
But if my blood sugar is high for an extended period of time, then we've got a major problem.
If you recognize my blood sugar levels are extremely high, immediately call my parents or a physician.
You should only inject additional insulin if specifically told to do so.
The other problem I have is low blood sugar levels.
Low blood sugars in the short term are much more dangerous because they can lead me to insulin shock. Low blood sugar levels occur when I have too little food or too much insulin in my system. Here are some of the reasons why I may have low blood sugar levels: taking more insulin than needed for the type of food I ate, not eating or eating later than usual.
Here are some symptoms to look for if you think my blood sugar may be going low.
Dizziness, nervousness, personality change or irrational behavior, blurry vision, shakiness, nausea, crying, sluggishness, sweating, poor coordination, hunger, lightheadedness, irritability, drowsiness, erratic response to questions, inability to concentrate.
See, I'm a regular kid. I just have type 1 diabetes.
But now you know what it means.
So don't be afraid.
Learn all that you can.
Because I'm just like you.